California is in the midst of a COVID summer surge with numbers as high as they were back in 2022. Wastewater testing from all across California from the CDC puts our state as one of just 8 in the very high category for viral activity. Now, doctors like to look at wastewater numbers because they're a better indicator of how widespread infections are in any given area compared to just case number data. Another thing to look at is testing positivity rates. In San Diego, data from the county shows that metric has skyrocketed over the last 2 weeks. You see it on your screen, from just about 6% at the beginning of June to more than 19% last week. I spoke with Dr. Andrew Eads from the emergency room at Sharp Memorial. He told me that he sees at least one patient each shift with COVID symptoms, and people need to pay more attention to how they're feeling, especially if you're in a high-risk category.
Yeah. I think that if you're somebody who's at risk for complications from COVID, like you have diabetes, obesity, heart disease, other things that would put you at risk, then maybe think twice about going to large gatherings or places where you would potentially be in contact with people who would have the disease. Wear a mask, wash your hands, do all the things you know to prevent infection.
Now, it's worth noting that the numbers that we have right now are still lower than they were even during this last winter surge and well below their peak from the height of the pandemic. Hospitalizations are also down because doctors say that COVID infections right now don't seem to be as severe, especially in people who are low risk. But Dr. Eads added, getting a vaccine booster is still important, and it's still the best way to stay ahead of any new strains that emerge.